I'm old enough and loud enough and difficult enough to harass prime ministers, premiers, governments, industry leaders to get involved. I've been thrown out of the odd prime minister's office. Oh, come on, people should just get their act together and do this. I'm Professor Ian Hickie. I'm the Co-Director of Health and Policy at the Brain and Mind Centre of the University of Sydney. By profession, I'm a psychiatrist. I'm an academic. I'm a researcher. I'm a public policy advocate for the critical area of mental health in Australia and internationally. My kids asked me recently, what exactly do you do? I said, well, I'm involved with anybody who wants to make mental health better through evidence, through research, through science, through public policy. I've been part of a transformation over the last 30, 40 years of a complete public shift from secrecy, from hiding, from stigma, from shame to openness. But openness now needs to be followed by real information that can be implemented individually and socially and through public policy. Challenges I've faced? Lots. People want short-term, effective answers that are wrong. And they're always more politically popular than harder, long-term answers that are complex and require longer-term, serious investment. My role in the last 40 years, and my role continues to be at two levels to try and shift public understanding and public investment. The big challenge in mental health at the moment is how do we take all the bits that we know and apply it to you personally? I think that's what we'll see in the next 5 to 10 years, a greater personalisation through smart technologies and much smarter application of science to you personally. The most satisfying aspect of my whole career is not the known public successes or the known entities or even the legacies, whether it's the marvellous buildings here at the University of Sydney or Headspace or the new access to psychological care, like the big ticket items. It's the individual people you see, particularly young people whose lives were ruined, who are on death's door, who would not have survived, who have recovered. The economic and social future depends on what's in the heads of our children and young people for the future. So when people say they care about the future, I'd say, do you? Because if you do, we can then look forward to a more prosperous, a more human, a more socially connected world where the old stigma, the old unknownness about mental health, the old sympathy but no understanding is replaced by genuine empathy and genuine action for a richer life for all of us.